transmitiendo nuestra comunidad al mundo.
Good morning, everyone, and good morning to our followers of Mariposa Community Health Center. My name is Eladio Pereira. I'm the Chief Medical Officer at the Health Center, and with me is Dr. Phil Williams, our Head of Pediatrics Department, who's been assisting us during the last few months regarding to COVID-19 and also helping us in this session. So good morning, Dr. Williams. Welcome. I'd like to thank Marco and Edgardo for helping us put this together. Also our leadership for supporting these sessions that we're doing almost weekly. We try to do that. What we thought we'd do today is actually speak about vaccinations in children and adults. And then we'll finish with a reminder about this coming weekend, which is a long weekend, and we have concerns about gatherings this weekend that can result in COVID infections in the next week or two. So I'll begin with some of the adult vaccines, and this is more of a reminder. I think a lot of this is known, but CDC, as they do every year, they release their guidelines for the upcoming year, and this year was no exception, 2020. And we look at those carefully to make sure we adhere to those, because after all, vaccines is a powerful tool for prevention of highly contagious illnesses. And as we've seen with COVID-19, certainly respiratory disorders and those disorders that are transmitted by contact really lend themselves to tragic consequences. And vaccines protect us to a high degree, and we'd like to review those. The first one is emphasis this year on the influenza vaccine. The influenza vaccine is recommended for everyone at this point, 6 months of age and older. So it's really important to vaccinate not just the adults, but also the children, particularly those who have respiratory disorders such as asthma, etc. So I recommend that we all get the influenza vaccine. At Mariposa, we have not received the vaccine yet. We hope to get it within a short time. We don't have an exact date. As soon as we receive, we start vaccinating right away to the entire community. And I think this year it's critical that we do that to reduce the respiratory disease burden due to COVID-19. We don't know when the COVID-19 vaccine will be available. As soon as we get that, we'll notify the community. So the influenza vaccine is really, really essential to do that. The efficacy rates vary from vaccine to vaccine. Influenza vaccine depends on historical data, probably somewhere 40 to 70% overall. We know the other vaccines are highly effective, such as MMR. With one dose is about 93%, 2 doses is 97%. That gives us a good idea. Then I'll mention a few others before I let Dr. Williams speak about childhood vaccines. I want to remind also about adults. Talking about respiratory disorders, the Tdap vaccine, which has 3 vaccines in it, has the tetanus, diphtheria, and pertussis. And we know that it's now recommended a one-time vaccination with Tdap for adults, and then every 10 years with the TD, which doesn't have the pertussis component, only the tetanus, diphtheria. A quick reminder that pertussis can occur in adults, particularly those who either have not been vaccinated or those who received vaccination a long time ago, and the immunity tends to decrease over time. The clue to pertussis is a prolonged cough that is very severe, lasting for a long time, sometimes weeks, accompanied by vomiting after the cough, and sometimes even syncope. Sometimes people pass out. So keep that in mind. We like to vaccinate everyone before that happens. Pertussis can be transmitted the same way by respiratory droplets. It's contagious, and And if we identify a case of pertussis, it creates a lot of issues because people close to the index case must be given medication with a macrolide. In this case, it's called azithromycin, and also the vaccine. And so it's very difficult to manage as well. So Tdap, a quick reminder, intensive respiratory disorders, influenza, and the Tdap. I mentioned a third one, intensive respiratory disorder. Disorder is called Pneumonia vaccine. There are two available. One is the 23-valent polysaccharide vaccine, which is the older one that we frequently refer to as Pneumovax. And the newer one is a conjugate vaccine called PCV13, which protects against 13 strains. That's called Prevnar. And the dosing schedule is a little complicated based on age and risk factors. We do recommend that you consult with your provider to determine which one you should get. The recommendations have changed. We used to give PPSV 323 and then we switched to PCV 13. At the moment, we're going back to PPSV 323 for most people, particularly those 65 and above, and we're giving PCV 13 first in individuals at high risk, those who have asplenia or poor spleen function, or have a cochlear implant, or they have leaks of the cerebrospinal fluid. There are conditions that do require PCV 13 first, and then we'll do the PPSV 323 8 weeks later. A little complicated, but the bottom line that that's published, you can follow it. So there are three certainly vaccines that help us protect against respiratory disorders: influenza, pertussis, and the PCV 13. A quick reminder, now that some of our students are going to school, particularly college, in the college dorms, about checking with your provider to make sure you're being vaccinated against the meningococcal bacteria. It's called Neisseria meningitidis. It causes, in some cases, very severe disease, bacteremia, and meningitis, and there's a vaccine that is useful, has 4 strains, but there are recommendations to administer that. In some cases, we will administer another vaccine that has a serotype B, but it does depend on the clinical condition. So a quick reminder that as the students go to college, to verify, and I think most colleges do require that anyway, so it is unlikely they will not have one, but I thought I mentioned it too. And then a quick reminder that there are some live vaccines that are not recommended in conditions that create immunosuppression and also during pregnancy, and those are typically varicella vaccine and the zoster vaccine in adults. The shingles vaccine, now there are 2 available, the so-called Zostavax and Shingrix. And it appears that Shingrix is now the preferred vaccine. It's a so-called recombinant zoster vaccine recommended for patients 50 and above. It appears to have a more robust immune response. It also reduces the possibility of having a prolonged pain following the infection called postherpetic neuralgia. So those are the ones that we administer. So those are on the adult side. I'm going to, Dr. Williams, really emphasize we cannot cover all of them. So we want to cover the ones that are respiratory in nature or protect against respiratory disorder, or that create a significant risk because of high transmissibility. So
Thank you so much. You know, one, I just want to say I'm so glad that we're talking about vaccines. I think in a lot of ways, you know, a lot of people kind of take them for granted. But if you really look at the great advances in not only medicine, but just in science in the last 200 years, you know, the automobile, the airplane, probably the internet, and then vaccines is right up there just because of the millions and millions of lives that are saved. And of course, the decreased morbidity just by getting a simple vaccine.
Right.
So in terms of vaccines, you know, in pediatrics, of course, there are a lot. And I first want to begin by stressing just how important it is. You know, as a pediatrician, part of my job is to make sure that, you know, have a normal physical exam, make sure you're developing okay, but then another big responsibility is to make sure that all my patients are up to date on their vaccines. So starting at birth is when babies get their first vaccine. So they're given the hepatitis B vaccine within the first 24 hours. And then the next big round of vaccines comes typically when they are 2 months old. So at 2, 4, and 6 months, they receive the DTaP, which is the diphtheria, tetanus, pertussis, the HIV, which tests for a type of Haemophilus influenza, and the pneumococcal vaccine are kind of the big three. We also give what's called the rototech or rotavirus vaccine, which is not actually an injection, but it's a liquid that the babies drink. That's also given at 2, 4, and 6 months. As you know, rotavirus is a common cause of pediatric diarrhea. Then, after 2, 4, and 6 months, there's a break until roughly a year old when we give the MMR and the varicella vaccine. The hepatitis A vaccine can also be given during that time. And then that's repeated again whenever they are 4 years old. And then there's another big break until kids are around 11 years old. That's when they're first starting middle school, when they get their big round of vaccines. That includes the Tdap vaccine, so the tetanus, diphtheria, the acellular pertussis, and also the meningitis vaccine. And we also really recommend the HPV vaccine. It stands for human papillomavirus, which can be a cause of cervical cancer. A common question I get is, you know, I have a son, should they get the HPV vaccine? So men, the answer is yes, they should still get their HPV vaccine. The reason is that men can actually be the carriers of cervical cancer.
Right.
And then again, the meningitis vaccine is repeated again at age 16. You know, in terms of a common question I get of which vaccine should I get? Should I get all of them? The answer is yes. we really recommend all of them. You know, some of these illnesses, as you mentioned, are highly contagious. So, for instance, you already said pertussis, highly contagious. Measles, very contagious. You know, if you look into the textbooks, you know, you'll see these really sick kids. Measles is really rare. I've actually never seen it. Actually, I've seen one case in my career. But the kids look very sick. So, and because it's so highly contagious, you have to have your MMR vaccine. In terms of respiratory infections, the pneumococcal vaccine is probably the biggest one that we protect against. There's something called pneumococcal pneumonia that causes what's called a lobar pneumonia typically, where it infects one side of the lung. So it's real obvious on x-rays just because one area of the lung will be affected. So, you know, please get your vaccines. Another common question I get is, if I get the vaccine, does it actually cause the illness? And basically the simple answer is no. So the whole point of vaccines is basically to trigger an immune response. We don't actually, so in most cases, you don't actually give the actual bug, but you give like a protein of it. So for instance, influenza vaccine, we're not actually giving you the flu. We're trying to stimulate the immune response by giving a specific protein that then will trigger your body to produce antibodies. So then if you are exposed to the bug in the future, you already have immunity for it. So again, probably the most important medical advance to happen, and we definitely recommend all vaccines.
Absolutely. Thank you, Dr. Williams. I want to go back briefly to the HPV vaccine. You mentioned it. I wanted to go back to that. It is recommended until age 26, so adults can get it. Recently, there has been a push to increase that age, and now it's recommended that after 26 until 45, that the clinician and the patient discuss that through what we call shared decision making to see if that's applicable to that individual. So I do get a question occasionally if the individual began having a sexual intercourse, whether the vaccine should still be given. The answer is yes. we should still give it. We have seen a significant drop in cervical cancers in HPV was first given. I haven't seen a case of cervical cancer in a long time, and I think our gynecologists feel the same way. So HPV, as you know, human papillomavirus, is the most important cause of cervical cancer, and it's highly efficacious. It's in the 90s. So we do recommend HPV vaccine for sure until age 26, and even later through shared decision making. So I'm glad that you mentioned that. We want to end the session on vaccine with a quick reminder about Labor Day weekend. It is a long weekend. It's been on the news lately. We have seen a significant number of spikes following holidays or long weekends, beginning Easter, followed by Mother's Day, Memorial Day, Father's Day, Independence Day, and now Labor Day. So we just want to emphasize the importance of not lowering our guard, using masks, keeping the distance, and doing all the prevention measures. It's really important to mitigate the spread, and we do that by wearing masks, keeping distance, washing hands, etc. So Dr. Williams, you have a few thoughts on that?
I think you covered it perfect. Please continue to do all the things that we've been talking about for the last 6 or 7 months. Continue to social distance, continue to wear a mask, continue to wash your hands, especially this weekend.
Absolutely. And if you should develop a fever, if you develop a cough or sore throat, recommendation is stay home, call your provider, because you may need to be tested. So someone who's sick should not come to work or go to work, call the provider. We do see spikes after holidays, typically beginning around day 5. The mean incubation period is 4 to 6 days, can extend up to 12, 13. So we do recommend that you stay home if you're sick, and perhaps consider being tested. Also testing those close contacts with those confirmed cases. So with that, I think we're going to end the transmission. We wanted to review today vaccines that apply to us, both in adults and children, particularly those vaccines that protect against respiratory disorders. We covered the importance of the influenza vaccine during COVID-19 era, and then we ended our recommendation with a reminder about Labor Day, and I hope we all adhere to that so we can mitigate the spread, and at some point we go back to our lives. So I want to thank Dr. Williams, Marco, and Edgardo, and the Mariposa leadership for this. I hope this is helpful to our community. This is a venue we use to communicate with our followers, our patients, our community as a whole, and we certainly hope that it is helpful. So thank you, everyone. We'll see you next week. Have a great weekend and stay safe. Bye-bye.
Transmitiendo nuestra comunidad al mundo.